when you feel that your airways are narrow. So we're talking about the medium and smaller airways, and when smooth muscle is tightened and there's inflammation of the walls, so the inner walls of the airways have swelled, and there's increased amounts of mucus in the lungs, in the airways. It's not a nice feeling because it's difficult then for air to travel from your nose into your lungs and back out again. And you feel it. There's an effort involved in breathing. You feel that you're not getting enough air. If you have symptoms, you might be wheezing or coughing. You might be overly breathless. And without thinking about it, you're naturally going to change your breathing patterns to try and alleviate that sensation of air hunger. So it is normal for people with asthma, especially if their asthma is uncontrolled, they will say, I just feel that I can't get enough breath. I can't get enough air. If I do physical exercise or if I walk up a flight of stairs, I'm going to be overly breathless. But see, here's the issue. That poor breathing pattern. So the narrowing of the airways causes a sensation of air hunger. And to compensate for that sensation of air hunger, you breathe harder, faster, open mouth, upper chest, which feeds back into airway narrowing, which feeds back into air hunger. So you can see it's a vicious cycle. So for a pulmonologist, for a medical doctor who is prescribing medication for clients with asthma and patients with asthma, asthma affects about 8 to 10% of the Western population. The countries with the higher incidences of asthma in the world, we're talking about Australia, New Zealand, UK, Ireland. We're talking about USA and Canada. And there definitely seems to be some Celtic genetic predisposition towards asthma. But having asthma is one thing. Having that genetic predisposition is one thing. But the other question is, how do you breathe? And we know from clinical trials of the Buteyko Breathing Method since 1994 that when a person with asthma, when they are taught to breathe in and out through their nose, when they are taught to breathe less air, so instead of breathing 14 litres of air per minute, which can be common with people with asthma, in between their attacks, in their normal everyday breathing. So if I have somebody coming in and their client coming in with asthma and I have them sitting down, I look at their breathing. And their breathing, especially if it's uncontrolled, is not good. Their breathing is faster, harder, upper chest. They're feeling that they're not getting enough air. Their control pulse is low. This person is over-breathing. Now, ironically, the person will feel, oh my God, how am I over-breathing? Because I feel that I'm not getting enough air. And they will think that their problem is that they are not breathing enough. And then we say, okay, I will explain, well, what's happening here is that you've developed a habit of breathing too much air. Your chemosensitivity to carbon dioxide now is higher than what it would be normal. And this is just, breathing is also a behavior. And we will change our breathing. So the brain changes breathing patterns in response to whatever experiences that we have in our life. If somebody has chronic stress, that can change breathing patterns. If somebody has asthma, their breathing patterns can change because of the things associated with having asthma. That airway narrowing, causing that air hunger, causing the change to breathing, and then that change in breathing becomes more permanent, becomes a behavior. But we need to change that behavior. And that's the thing about breathing. We can change the behavior. So with the person with asthma, we need to bring their breathing volume from being 14, 15 litres of air per minute during rest, in between their symptoms, down towards 6 to 8 litres of air per minute. And the more we can address and normalize their breathing volume, the more we can improve their symptoms.